Hello and welcome to today's Women in Leadership series presentation that we're doing here at Truman Medical Centers / University Health. I'm Jake Pitts. I am a senior coordinator in our Equity, Diversity, and Inclusion Department, and I'm joined today by Dr. Tiffany Ruffin. Dr. Ruffin is a nationally registered licensed health psychologist who graduated from Forest Institute of Professional Psychology with a master's degree in marriage and family therapy. She also has a doctorate in clinical psychology. During her postdoctoral training in Colorado, she focused on psychoeducational evaluations. During that time, she began to see the impact of focusing on strengths to overcome perceived weaknesses. Also during that time, she worked with Dr. Katrina Caton, who introduced her ownership yard concept, which is now a book, a great book, might I add. In my previous conversation with Dr. Ruffin, I ordered one for myself, and it's fantastic. So after this, get on Amazon and look it up, or wherever you get your books. As Dr. Ruffin began approaching behavior change from a strength-based and empowerment point of view, she saw that people make impactful changes in their lives, and she was starting to feel proud of that particular perspective and how coming from strength-based was making that difference. Currently, she works as a behavioral health consultant at CMCUH's Women Health Services, where she's able to continue sharing this model for change. Dr. Ruffin is very passionate about sharing information, connecting with people, and helping guide people to understand themselves through a strengths-based and empowerment-focused lens. Without further ado, Dr. Ruffin, thank you so much for joining us today.
Hi, thank you. So happy to be here.
Yeah, hey, I'm happy to have you here. It's going to be such a fun time, but it's also going to be really enlightening for myself. I want to own early, as a male interacting with you on women's emotional health, your ascension to your position, the exercise of what you believe in. It's going to be very humbling for me, and I can't wait to hear your thoughts today. Thank you again. I'll tell you what, I think a great way to kick it off would be for you to share just your role, your philosophy toward women's health care and emotional health, if you don't mind kicking us off with that.
Yeah, absolutely. You're absolutely correct. I get pretty passionate talking about these things, love sharing information and ideas. And I think that is part of really my philosophy and change is sharing information. One of the things I feel really strongly about is recognizing how to shift healthcare to this truly integrated model. I feel lucky that I work here at Truman where we do have support for that. And so it's really being able to destigmatize emotional health, mental health, specifically where I'm at with women is looking at the full overall picture of health and what that means. And so shifting from the model of, well, you have your physical health, your emotional health, your mental health, it's all connected. And so being in the position where I am now, able to go to women's appointments while they're here to see their OB physician, walking in that appointment and connecting with that patient right there in the room, talking about stress management, because who doesn't need that? Like everybody needs that. There's nothing wrong with you because you're struggling with some stress right now. Post 2020, everybody needs that. And so really normalizing that it's okay to not always be okay, right? Sometimes we need to hear that. I think especially the pressure that women can put on themselves or can be put on them as mothers. That's another area that I focus a lot on, and recognizing that when we as the healthcare system start making that shift, it also translates into the individuals that we serve of saying, hey, it's okay to not always be okay. And it's okay that there's someone who is a behavioral health consultant who can come meet with you at your appointment, not because you're crazy, not because you're too emotional, not because you're too much or not enough or whatever expectations someone else is putting on you, but because we can all benefit from understanding ourselves better. And that's really what I get passionate about, is getting away from labels and bad and good and right and wrong, and finding that area of what's consistent with your values and how do we line up what you want within that value system. And then as people like me are able to do that, interject and keep showing up these appointments in the clinic and normalizing it, I think that allows us to transition and translate that to the medical system so that we can all see that we have such a valuable role of improving health outcomes for everybody when we work together, and shift from that competitive mindset that I think women especially can get caught up in. There's a lot of pressure I've seen at times for women to feel like we were competing against each other even. And from my own experience, thinking back to graduate school, and that message that there was a lot of competition. You know, you have your class ranking and all of that, and there's competition, and it's easy to get sucked into that mode of competing, and scarcity. And then if you take a step back, so with what you're talking about, my experience in Colorado kind of helped me change that perspective of taking that step back and recognizing, what if stop competing and looking at this scarcity and started looking at ways we can collaborate with each other, collaborate with the medical team, collaborate with all the people, because there's so much great information and different points of view that can be shared if we are less guarded and more open. And I think by me taking that personal shift, it's allowed me to kind of bring that philosophy to everywhere I go. It's just kind of who I am, where I'm just come from a place of curiosity and wanting to understand things and really wanting to understand different perspectives, um, and getting away from this idea that there's good and bad and right and wrong, and more of what works for this person. So looking at people as individuals who all have different needs, but they don't need to see me, for example, because there's something wrong with them. Just like in a perfect world, you don't necessarily go to your doctor because something's wrong. We want to get to a place of preventative healthcare and being able to really focus on our strengths and the things that are going right that have gotten us to wherever we are now to overcome whatever we're struggling with.
Yeah, wow. I mean, I'm immediately struck with like your perspective is make this person the expert of their own emotions, their own mind, this part of ourselves that can steer our will, steer our behavior. Um, and you said something a moment ago about destigmatizing the mental health conversation. How do you go about that? Like you're stepping into a room with a patient or a client, and that's probably the first bridge that you have to cross, I imagine.
Mhm. Absolutely. So a few things. One is really trying to get to the place where I'm able, the integrated psychologists we have are able to meet as many people as possible. And so one of my dreams is to be able to meet every single OB patient who comes through here, because I really want to normalize it and recognize that everybody needs help. You know, there's nothing wrong with needing some suggestions or support or encouragement or just to be heard sometimes. And so really normalizing the experience of my role that I'm coming in, and really how I introduce myself. I try to be intentional on the way that I describe what I do. So I'm intentional in the words that I use. So instead of coming in as, hey, I'm a psychologist, because 9 out of 10 times this is the response, like arms crossed, like, who sent you in here? Like, why is there a psychologist coming in my office or in my patient room? So shifting from some of that language to really describing what I do, which is I'm here to help provide support. I'm here to provide resources. I'm here to give you some tips and strategies, and to just kind of hear a little bit about you and get to know you, and anything we can do to help your care here. I'm here to help facilitate that if I can. And so recognizing the words we use sometimes can make a big difference in the stigmas that are associated with what we're talking about. Because at the end of the day, my goal is really to help empower people to feel more in control of their own healthcare, advocate for themselves, and decrease those barriers. And so if I do that, saying, hey, I'm a psychologist, here's what I do, and I get shut down, versus, hey, I'm this person who's here to help. How can I help you? So shifting the questions that we're even asking.
Wow. Wow. You got a little bit into it a second ago. I want to dig into a little bit further. Just the spark. What led to your pursuit to this field, and to your impassioned and specific approach to emotional care?
So I think for the second part, kind of my approach, it goes back to that postdoc experience where first time in my life, I was kind of exposed to this idea of looking through the lens of what's right with people and helping them overcome whatever they want to overcome instead of what's wrong. And as a throughout the psychology doctoral program, it was very focused on pathology. You know, you focus on what's wrong with someone so you can help them fix it, quote unquote. And so it was the first time that it was like taking a step back and saying, wait, there's another way to do this, still get the same result, and maybe even, in my opinion, a little quicker and better, and looking at it differently. And when I made that shift for me personally, all of a sudden, work felt so much different. What I do felt so much different because I wasn't trying to do what I thought I was supposed to do. I was just kind of me. And so here where my current role, people will comment like, gosh, like patients have said, you seem like you genuinely like what you do. I'm like, no, I do. Like, because I'm not trying really hard. It's really just, I feel lucky. I feel blessed because I get to just be me. So I'm genuine to who I am. And through that, encouraging other people to do the same in different ways of their own healthcare, of not apologizing, not minimizing, not dismissing your own experience or trying to fit into a box that you might not fit into. Instead of trying to fit into that box, look for other ways to be a part of that box, or to push that box aside and make it a circle. Whatever the case may be. So for me, I get to just be me. I get to be authentic and genuine, and just look for the good in people and the ways that they can see themselves and accept themselves, while focusing on things that they want to change, not the idea of toxic positivity where we're acting like everything's always great and roses and perfect. Not by any means. It's okay that this is hard. You don't have to be perfect. It's okay that it's hard. It's okay to struggle. And here's what can you do with it? How can you find ways to overcome whatever you're dealing with? And so here specifically, I think if I'm going on and on, the first part of your question of kind of how I do that here, um, or led me to being here, is I kind of make the joke when I talk to people about how I kept, and I continue to keep showing up at meetings that I'm not invited to. And so I've made a joke, and it's true, and I've shared this with other people as I'm working with them, that sometimes that's, I believe as women especially, that's what we have to do. If we're sitting around waiting for invitations, we might be waiting a really long time. And so my kind of philosophy is you just keep showing up until they tell you to stop. And maybe if you choose to, you can ask for forgiveness later. And maybe you don't, but you just keep showing up at the table, and you keep giving your perspective and your ideas and sharing them, not necessarily because people are asking you for them. And that kind of goes to the ownership yard perspective, which is when I am sharing things, it's not to change someone else. It's not because I can control someone else's thoughts, feelings, or behaviors, because that's outside of my quote unquote yard. I'm sharing things because it's my reality, my experience, and it's valid, even if no one else validates it for me. Me saying it out loud sometimes is validating. And so for me, showing up at the table, keep going to these places, even keep showing up in clinic, right? So there's a resident clinic, and I just keep showing up as the psychologist who's like, hey, I'm going to go in your patient room. I'm going to introduce myself. Huh? Why? I'm just going to introduce myself. Oh, okay. And teaching through doing. And so I think that's a leadership style as well, is modeling, just being who you are, doing what you do, and being authentic in it. And then that creates a leadership where people are like, huh, how is she doing it that way? What is she doing? And then
Yeah.
we want to do more of that. It's like, I want to be me, like whoever this person is. I'd be able to go to a job and just be myself all day. That's awesome. Wouldn't that be great if we could all do
Yeah.
that?
Yeah. The way that you're describing this approach as well, um, first, it reminds me of something we were joking about before we got on the call. We both want to be like Dr. Tracy Johnson when we grow up.
Yes.
Um, it's like the idea that, well, actually, she said it herself in our previous women in leadership session. The idea of, if people don't want your light, just give them some shade. Keep
Love
being
that.
who you are.
Yeah.
That's how I received that message, was keep
Mm-hmm.
being who you are. And I want to compliment you, because as you were sharing that, the light bulb that went off for me was, that is probably helping to remove the competition that you were talking about earlier. I imagine, at least, has
Mm-hmm.
that been your experience? Is stepping in with that boldness has shown, hey, this doesn't have to be a competitive thing.
Yeah, I think by recognizing, one, I'm not responsible for other people. And I think, again, women get that message a lot. And it's a message that I myself remind myself two things, and it gets a little confusing, so bear with me. But getting comfortable being uncomfortable, meaning getting comfortable showing up at tables you're not invited to, getting comfortable that someone might need to wear sunglasses around you because your light is a little bright for them. So getting comfortable with that discomfort, while also recognizing, with the ownership yard concept for me, that it's not my responsibility to take care of everyone else's emotions. And so I don't need to make myself uncomfortable to make someone else comfortable. So getting comfortable being uncomfortable, in that I'm doing what's true to me, but I'm not going to do what's not true to me just to make someone else comfortable. And so it's kind of teasing out what that means. But I think that there's a shift whenever you are true to who you are and not trying to be what you're supposed to be or what other people need you to be or want you to be. That then all of a sudden it doesn't feel so brave. It doesn't feel so courageous. It really just feels like you're just being you. And so sometimes, like when we're talking about, I think the first time we talked a little bit, and I was like, well, just to be very clear, like I don't have an official like leadership title. That's not something like I like. And so recognizing that it's not always the titles that we have, it's not the roles that we fit, it's really just who we are. And when I'm trying to be who I am, I'm not competing with anybody, because the way that I'm going to do something is completely different than someone else. It doesn't mean it's better than or worse than, it's just different.
Mhm. In showing a practicality to the integration that you were talking about. Like, it's the way that you're doing this is such an effective tool for also advocating for the kind of care that you want your patients to receive at the same time. Yeah. Were you about to expand on that?
Well, I think just pointing out, I feel lucky to be here at Truman because there's a lot of data, there's a lot of research that supports the integrated care model. So supports having behavioral health consultants, licensed clinical psychologists integrated in a medical healthcare system, because we recognize the benefit, the value, and the connection between this idea of emotional or mental health and physical health, that they're all interconnected. We know this. This isn't new information. And yet there still seems to be, my experience, some resistance in a lot of healthcare systems of getting on board with that. And I feel lucky to be here because we do have a great department of integrated folks in different groups that I think are really making a huge difference in the way that healthcare is done, and
Mhm.
giving people the care that they deserve, that we all know is benefiting not only the individual, but also the community at whole, whenever we are having healthier, more empowered people who are able to take control of their healthcare and feel like they have a voice, even when we're in these systems, that all systems are broken to some degree. And so when we're in these broken systems and there are things we're not in a place where we're able to change, or certainly change can be very slow, is going back to that ownership yard for me, is what do I have control over? And so sometimes it's still standing up for myself, asserting myself, saying things, even if no one's listening or no one seems to really care. My goal in sharing information isn't to change someone else. It's really to empower myself and recognize what I say matters.
Yeah. Yeah. Yes. I had complimented the Ownership Yard book earlier, and as you are sharing that concept of it, like what you own, how to proceed with life, knowing the boundary of your own ownership versus maybe external influence and everything. Like, I'm admiring the fact that you're saying, like, I can own my own position, give myself the acceptance that I want to receive from the outside, give myself those things as a way of nurturing my own ability to step into the world, be who I am.
Mm-hmm.
Um, this this question may be a little um, complex. I don't intend it to be, but how does somebody maybe tend to their ownership yard, so to speak?
Mm-hmm.
Does that question make sense?
Like taking care of their own.
Yeah, like how do you build those boundaries of like understanding here's the end of what I own. Here are the things I'm going to cultivate in my yard, um, and thus being able to step out into my own life to say, like, okay, this is how I can establish my direction, where I want to go, achieve my goals, care for myself, things like that.
Yeah, so boundaries are one. You mentioned boundaries. That's a big one. And with that, I think to be comfortable with taking care of your own yard and not feeling responsible for everybody else's, or that other people are responsible for yours, comes to first kind of knowing your yard. And so knowing your own values, your own things that are important to you. And that comes from that acceptance of this is who I am. And I think a lot of it for me, and from when I work with people, is deconstructing this idea of good and bad. We get stuck in this perfectionism and this idea that it has to be perfect. It has to be, I have to be the best. I can't make mistakes. Like it all has to be just perfectly done, just right. Otherwise it's either I'm right or I'm wrong. I am doing great or I failed. And so deconstructing some of that and getting into what if, my famous words here are always like, I wonder, because I'm coming from a place of curiosity, like, I wonder what would happen if, I wonder. So I wonder what would happen if we accepted ourselves and said, here are things I want to change and work on and improve on. And so getting rid of buts, because that's my other thing, is the buts, just like no buts, no cancel out here. So instead of buts, change it to a can or and. So instead of I need this, but I wonder if I can be working on myself and loving myself at the same time. So recognizing who I am, what are my values, how can I frame that in a way that is okay, that it's a work in progress? Because I think people who are reflective and self-aware and interested in getting to know themselves and improving themselves are often critical of themselves because they're able to see so many different perspectives and areas of improvement. And it's easy to go down that path of never being good enough because it's always more to work on. And so shifting that to, I have a lot to work on and I'm doing a really great job. And here are things that I'm doing really well. So understanding yourself, what's important to you, redefining your values, and then looking for where are the times in my life that I feel resentful, that I'm feeling anxious or stressed out or frustrated, and is there possibly misplaced ownership? So in those situations, are there times that maybe I'm expecting someone else to take care of or be responsible for my thoughts, feelings, or behaviors? Or are there times when maybe I'm jumping in someone else's yard? So first recognizing where the misplaced yard work is, and then being able to get into your own yard and start questioning and challenging some of those initial quick to go to that person's yard or bring their stuff in my yard. So I use the example, if I'm going to meet someone for dinner later and I'm running late for work or running late to leave for the reservation. And so I don't finish my notes and then I speed and I get a ticket and I get there and I'm like running in, I couldn't find parking, whatever. I run into the restaurant, I'm late. And then the people I'm meeting aren't even there yet. I'm like, but I just got a ticket and I didn't do my work and I did this and I did that because you guys made me late. And it's like, oh, hold on, check yourself. No one made me do that, right? That was my choice. Because my value was being on time over following the speed limit or over getting my notes done or whatever the case may be. So I chose to do that. Oh, at first it feels really yucky because now I have to take ownership of that. Like, no, I want them to, like, I'm upset. Like, you made me late. You didn't really make me late. And yet I'm kind of frustrated. And so it's still valid emotions. It's not to say the emotions don't matter. It's okay to feel frustrated in the situation with those people and to recognize, so getting away from the but, and I valued being on time.
Yeah.
Maybe they did not choose or they don't value the same thing.
Yeah. Gosh, even the simple tool of removing the word "but" from your language is something that's like it removes a self-limiting practice.
Mm-hmm.
Everything you've just shared has been very insightful for myself, and I'm sure it's insightful for everybody listening about like within your yard, there doesn't have to be a ceiling.
Mm-hmm.
And how well do you know what's there? I love that. I love that. Dr. Ruffin, what words of advice, words of wisdom would you give those who are still searching for their own spark, their own like drive, maybe that primary purpose?
It sounds incredibly cliche and it's kind of difficult to say. And I find it to be really true it's important to learn who you are, learn, kind of get to know yourself and learn to love and accept yourself, which I know is such an incredibly cliche thing to say, love yourself. When I say it, I cringe a little bit myself, like, oh, I know how this sounds. And I've had people come back who will do therapy and 5 or 6 sessions later, they're like, oh my gosh, you were so right. Like I had to learn to love myself. And yeah, I cringed too when you said it. And that's okay. And that's a really important start point is knowing yourself, knowing what's important to you, and then looking for the areas in your life where, as you called it, those self-limiting beliefs are. So where are there times that I'm allowing maybe someone else's perception or expectation of me to stop me from doing what I genuinely believe or feel is the right thing to do or the thing that aligns with who I am or who I want to be? Because if we identify those areas, then we can start to kind of change those, shift those, look for different ways of getting those needs met for ourselves instead of this pressure to take care of everyone else or make everybody else comfortable. And that comes at also the cost of being comfortable, being uncomfortable. And so I think it requires a willingness to be uncomfortable. Anytime we're talking about, okay, I want to change in my life, I want to feel more confident or more empowered in who I am, often any growth can be painful. And so reminding people too, like pain doesn't equal bad. Sometimes that's another message of like, if I feel sad or angry or upset, that's bad. And we look through for women specifically, some of the history of that. And we look in psychology specifically in the 40s and 50s when kids would be diagnosed with, at that time, autism or schizophrenia. And it was then put back to the refrigerator mothers, parents, specifically mothers, that were too cold and emotionally vacant. And that's what was causing these children to have these symptoms. So at that time, the message was women were not emotional enough. And then we fast forward a little bit, still in the 50s, and that is when the diagnosis of hysteria came about, and women were being admitted in inpatient psychiatric facilities, were having forced hysterectomies because they were too emotional. So we look at kind of the putting it in context of history of how there's been a message to women of don't be too emotional, but also don't be too unemotional. We really need you to be just as emotional as we, whoever this we is, want you to be.
Yeah.
Like, hold on, whoa. And that lends itself to a lot of doubt. And so women are in workforces and in their role of whatever that role is, doubting themselves and saying, well, maybe this isn't how I'm supposed to be. And maybe I need to be this. Or if I want to be a leader, I can't be emotional. If I want to be this, I can't be that. And it's, again, eliminating those can'ts, like, says who? Where do these beliefs come from? Because often we hold these beliefs that when we stop and say, where did this come from? It's like, not my value system. Why am I holding on to this? Well, it's the system I'm living in. Well, maybe it's time for you to change your role in that system. Can't always change everything, or don't know how to. I like to replace the can'ts with don't know how to change everything or the systems. And maybe I can learn how can I change my own role in that system.
Yeah. Wow. Wow. My brain is trying to pick which thing to to go because I'll share honestly. Uh, as a man, hearing that, I'm hearing there's space for me to own where am I putting pressure on women to say, please don't be extreme in this direction, but also don't be extreme in this other direction. There's a sweet spot, and if you could find that'd be more comfortable for me. That would be better.
That would make me more comfortable if you could control your emotions in a way that feels right to me, whoever gets to decide that at that day.
Whoever the they is, I think that's a part of a call within this message right here is like, can we be mindful of how I'm communicating on a macro or micro sense? Am I being aggressive? Am I creating limitations for this person that don't need to be there? And maybe, hopefully, somebody, when evaluating the existence of that, might be able to say, I don't know why that exists, but now I just feel convicted about it. I love that response came from you in a question about words of advice to people searching for their own spark, because I was also hearing, when you believe in something, give yourself permission to believe in that.
Yeah, and definitely don't wait to get permission from someone else. And I think that's kind of the overarching theme of it all. Don't wait for permission to have your feelings too, right? And so, okay, I'm upset and I'm crying. That's okay. I don't need permission from someone else to tell me that it's okay to have that emotional experience or not to have it. Or I'm going to show up at this table even though I wasn't invited. I'm going to feel really uncomfortable, and that's okay. I feel really anxious, right? That is okay. And so stop waiting for permission or invitations to be you, permission to be you, permission to share your ideas, invitations to show up and share them, and just start doing. I think that's the big picture. Just start doing it. And I kind of joke with people here of the Nike slogan, just do it. It's sometimes I don't feel like it. Sometimes I'm really anxious about it. Sometimes I'm unsure. And sometimes the answer is to just do it anyways. So even though I make the joke, like, feelings can be liars, I don't ever want to minimize someone's emotional experience. Feelings are valid, and they have a purpose and all that. And sometimes they lie to us. And so trusting them blindly is probably not the best choice. And so recognizing it's okay that I don't feel like doing this, or I don't feel like I was invited, or I don't feel like other people want to hear what I have to say. I'm going to say it anyways, because I'm not in control of their yard. And so, again, coming back to what I have control over, which is asserting my own opinion or thoughts, ideas, whatever it may be. And the other thing is to stop apologizing too, is recognizing there's a tendency to apologize. And again, trying to make other people comfortable and giving yourself permission that it does not have to be your job to make other people comfortable. And with that comes if it's my core value to be a kind person, it doesn't mean that I'm not going to align with that value of being nice to other people, but it's not because I want them to be okay. It's because that's who I am. And so my value is to be nice, so I'm going to be a nice person. It's not, I'm nice because I want you to feel happy. I'm nice because it's important to me to treat people a certain way.
Yeah, yeah. The exercise of your values is a very inspiring thing for me because your choice. You had said earlier, like I don't have a leadership title,
Mhm.
but you were expanding on like, but I'm leading my life. Like that's just it's something that's coming to the front of my mind. The more that you share is like this ownership of who I am, being bold with that because I feel like, and I don't know if you would agree with this, but I feel like that ownership is like, well, the reason why I want to be this way is because I also hope for the existence of these things in my life, in my relationships, in my career, whatever it may be. So again, on the point of permission, giving yourself the permission to say like, okay, you know what, I'm going to create that. I want forgiving relationships. I want graceful relationships. I'm going to own up to when I have maybe have done something wrong. I want an environment where I can own my own emotions. Okay, well, like you even said, giving yourself that space to say, this is how I feel in this area. I'm not going to make you deal with it, but I'm going to make myself the room to say, here's where I am. Here's how I feel about it. The ownership perspective that you're talking
Yeah, and the idea with the kind of tool is getting away from or using, for me, it was the feelings are liars just resonated with me because there's also I've seen a tendency to we want to justify our emotions. And
about.
so like I know I shouldn't feel this way. I know that logically X, Y, and Z. And certainly with depression and anxiety, when we talk about things like that, often people can tell me all the reasons they quote unquote shouldn't feel depressed. Like I have this going for me and that going for me, or they shouldn't feel anxious. I have this and that. And yet I still feel this way. And so what if, I wonder what would happen if we held on to the belief that feelings don't dictate our reality. They're still valid. They're important. We need to validate those emotions because they're real and they don't necessarily dictate reality, meaning um, just because I feel that way doesn't mean that it's the truth because I might feel insecure, I might feel unsure, I might feel unwelcome. And maybe I am, maybe I'm not. And if I just do it, even though I feel it, the outcome then allows me to live a life that's consistent with who I am and who I want to be. And so it allows me to do things that are true to who I am.
Wow. Wow. Um, you're kind of touching on this already, but I wanted to ask you, what are some emotional health strategies that you would recommend for everyone?
I think kind of going back to knowing yourself, figuring
Mhm.
out what are your emotions. That's the other thing is a lot of us, and I make a joke again with when I meet with women at their OB appointments and I go through some apps and videos that are helpful for stress management or relaxation. And I say, my experience has been people are really good at telling others, especially women, to calm down, relax, just don't worry about it.
Yeah.
Okay, first of all, if I'm upset, don't tell me to calm down. That's not going to help anybody.
Uh,
Um, Never in the history has that been effective. So we should probably maybe consider not doing that anymore. And then number two, maybe there are times when I would agree with that statement and say, yes, it would be beneficial for me. I'm choosing to, I would like to learn how to calm down in this moment. And I don't know how. And no one ever teaches us how, or no one ever taught me how. No one sat me down and said, here's how you need to calm down. Here's how you need to regulate your emotions. But we're expecting that everybody just knows how to do this. And if someone doesn't do it the way we want them to, or as effectively as we want them to, then it's quick to be like, you need to calm down. You need to this, this, and this. Okay, how do we do that? And
mhm.
so I think from a very practical standpoint, first, not looking for someone else to tell us what we need to fix or make better, not going to a psychologist even to say, hey, what do I need to make better? But asking yourself, what do I want to change in my life and why do I want to change it? How would my life be different if these things were different in me? So clearly defining what that means to you, emotional health, because what it means to me might be very different than what it means to someone else. So getting away from there's a gold standard of what emotional health looks like or mental health and recognizing on an individual level what are areas in my life that I want to improve, what are areas in my life that there are things that are holding me back
Yeah.
or aren't allowing me to be live congruent to who I hope to be. And
Yeah.
then after defining those, then it's coming up with the practical strategies for relaxation. Truly, there's apps, there's videos, there's breathing exercises, things like that. But I believe that a big part of that, I always like to draw on a board. So there's two places. So there's this side here that has change. So these are the things I want to change in my life or feel differently about. And then here are the things that I want to learn how to accept. And so divvying out what are the things that maybe either are less likely to be changed, because there are things within us that are our personality and things that probably won't be easy to change. Or
Mhm.
if we try to change them, that's when we get really resentful and we aren't living a life that we feel good about, and we're stuck feeling tired all the time and just not good because we're trying to be something that we're not, because we're trying to change something that is just who we are. And so what are some things that maybe I can accept about myself that other people might, I feel like, would appreciate if I did differently? And it's probably just who I am. And so how can I learn to accept that and not let that define me, and embrace that and look for ways that it's actually served me? How has it been a strength in my life to get me to where I am? And then the other column is, here are things that I actually are important to me to change. So one is clarifying that and not basing it on what other people need or want from you, but what do you want for yourself and why? Because sometimes people will make this list and they'll start with this list of, here are the things that I want to change. And then when you get to the why, it's like, well, because, at work, this person doesn't like this or that. It's like, what about you? What about you? And sometimes we forget that. That's like the last person we consider when wanting to make changes or do things differently in our life. It's like, well, this person needs me to do this, or this place, this role that I am filling here needs, or they expect this from me, so that's what I have to do. Okay, and what if there were, I wonder if there weren't those expectations, what would be important to you? And I found for a lot of women, again, because of the population I work with, motherhood is a big role that can create a lot of transition and change of identity. And so as women, I think figuring out your identity of who you are and who you want to be, and then figuring out how to get there, kind of having the end goal in sight and then figuring out the road map of how to get there. And I'm a huge believer in therapy, and destigmatizing the idea that you have to be sick or broken or crazy or all the stigmatizing words to reach out for support and help. And my hope from what I've seen this post 2020 world is that one of the silver linings is I feel like there's been more of a conversation on emotional health, mental health. And I'm hopeful that that is going to lend itself to decreasing some of the stigma and decreasing this idea that something's got to be wrong with you to utilize services from a psychologist. I mean, we're in healthcare because we recognize everybody needs support. Everybody can benefit from stress management, from whatever the goals may be. It doesn't have to be because you've been flagged because you cried, and that means you must be too emotional.
Um, wow, you simplified it so well. um, just kudos on your expertise on this.
Thank you.
Um, it's 12:40 right now, everyone. In about 10 minutes, we'll open it up for questions. Feel free to use the chat to submit your questions, comments. I will be facilitating those soon. Um, Another honest and vulnerable question for you, Dr. Ruffin. How could men be allies and advocates of women's emotional health?
So I think looking at the language that we use, one, and so I think there's often a quick dismissal, and not intentional. And so the other thing is looking at the intention of something versus the impact. So often good intentions can have devastating impact. So recognizing the words that we use when we talk about emotions, even, and being mindful of the language. Two is being supportive, I think, of women in leadership roles and recognizing that they're, and looking at the tables that you're sitting at. I think that's a big piece. Looking around at the tables that you're sitting and say, who's missing here? This is not just for women, but certainly for minorities. And when we really want to talk about women of color, I think that's a whole nother conversation of looking around the room and saying, wait, who is missing from this table? And if you notice that gap, speak up, advocate, encourage. And then when those people do show up at that table, I think, if the microphone is not being sent their way, encouraging that, allowing for that, and then supporting those people who are in leadership roles, who may have struggled to get there, and recognizing ways that you can support them. And often I find in a lot of areas people aren't sure how to do something, and so they just don't do anything because it's like, well, I don't want to say the wrong thing, or I don't want to misstep or come across, again, I'm trying to take care of someone else's yard because I don't want them to think that I did this or that I think this. And so a great way in a specific situation is just to ask, if you're at one of those tables, or if you notice someone's not at the table, and then asking the people who are in those positions, or who maybe have really great ideas that aren't being heard, asking them, how can I support you? I think you have great ideas. I think that this is really important. I hear you. Is there anything I can do to support you? Because everyone's needs are going to be different. Um, and then the other piece of that is really that I hear you. So validating and seeing, or recognizing when there's a deficit, when there's a gap, someone missing at the table, being able to call that out and advocate for, looks like we're missing a really important demographic here, really important perspective.
Yeah. So on in this past week, I had the immense pleasure of sitting down with Hayat Abdullahi. She's Truman's senior director for community health strategies and innovations. Just brilliant, brilliant person. And her story of stepping toward tables and wanting, well, actually, no, actually, to more accurately express what she was telling me in the article that we have published now is being invited to the table and then having the courage to speak. You went toward a similar topic there, and I'm wondering how, when I hear a woman in leadership, maybe a woman who doesn't have a leadership title, but she's taking the lead in this matter that maybe we're in a meeting about. What are practical ways that I could activate that person's voice without laterally doing something that's microaggressive?
Mm-hmm.
Like, oh, you had a point on that, didn't you? Because I think there are a lot of ways that, again, just being honest, I think there are ways that men might approach activation that might not actually be honoring to women at a leadership table, or in an initiative. So it's a convoluted statement from myself, but what I'm meaning to deliver is, when it comes to men trying to activate women, how can we do that in a way that's honoring?
So I think it's probably, I'm not sure that I have a great answer. I'm thinking to myself, there's this kind of ownership piece too, of recognizing where the ownership kind of starts and stops. And so what your role is, even as an ally, in being able, what you have control over, and what you're in charge of, or, able to own in that situation, versus whatever that person themselves is able to own and take responsibility for. And I think if we are able to better shift into this culture of like collaboration away from competition, where we're really collaborating and trying to understand and meet people where they are, instead of where we think they should be or how they should be. And because for some people too, thinking that we all learn different, we all have different temperaments, different ideas, different ways of expressing those ideas, is being willing, I think when you get those seats at that table, if you're not comfortable speaking up, maybe you're more comfortable emailing after the fact. Maybe you're more comfortable. So I guess my answer is kind of shifting away from what men can necessarily do, but what women can do, is looking for knowing yourself. And again, if you're not a great communicator on the spot, because not everybody is, and it has nothing to do with your competence or your intelligence or your brilliant ideas, you might, like, your brain might work differently, where you are someone who processes differently, and you might do better with writing it down and processing it. So I think if you're anyone, but a man in a leadership role or on the head of the table, is really creating space for different people to have different ways of being a part of that system. And so it doesn't have to be, we have to go to this meeting, everybody has to, whoever's the loudest is going to be the one that we listen to. We're all going to look at different ways of writing down ideas, emailing after the fact, communicating in the moment, but recognizing that there's this like collaboration and so much more is going to happen when we stop getting stuck in this only one way of doing things and recognizing, hey, this could be a different way of doing them. And maybe we send an email to the whole team and whoever wants to participate can. And if you don't want to share right now in the moment, can you email after, or can you write it down, or looking for different ways to really use everyone's strengths, because everybody has great ideas and things that could really make a big impact. And sometimes the best ideas are getting missed because they're at the table and they're not comfortable sharing. They're not the loudest voice. They do things different. And so recognizing, getting away from the idea that this is what leadership or what meeting agenda should be, and looking at how else could they be to be more inclusive.
We're going to switch to questions here in a moment. If you all want to go ahead, if you have a question prepared, feel free to throw it in the chat. I'll get to it in a moment. You said you didn't have like maybe a prepared or a good answer for it, but that was amazing. And I say that because that response that you just gave opened my mind to, wait a second, maybe inherent in our activation practices, maybe it's laced with competition in the first place. Maybe it's laced with, oh, go ahead.
And I in my mind too, it's the idea of like you're taking on the role of like activator, like you're in charge of giving someone permission or giving them the okay, that it's okay to do it. And so I think with the ownership yard, recognizing maybe it's not your job to activate, but maybe it's your job to be open or allow for that voice to be heard in a different way, however that may be, without being responsible for initiating it or activating it. And so shifting from like the ownership, it just, to me, it triggered on like ownership yard, like what is your ownership in this person feeling comfortable at the table? And so certainly being intentional with your own core values of, I want to be kind and open and hope that I'm reflecting what's true to me, which is that I want to hear your opinion, and recognizing I'm not responsible for making you share that opinion or feeling comfortable in that way.
Yeah, wow. So approaching activation in a way of like, activating isn't just simply putting a microphone in front of someone's face, but being able to say, hey, I actually welcome you to have ownership here. Where we're gathering so that you can have a place here. Sometimes when I lead meetings, I'm like, I like to say, hey, the expectation is that we would all leave something on the table, But now I'm like reevaluating that, like, that could be broadened. That could say, thinking more specifically about like, okay, if you're gonna put something on the table, like how could I elicit that from you? Yeah. Something that this echoes something that Hyatt shared with me about, hey, we're in the background. We are just waiting to be heard. And a lot of what you're sharing today has me thinking like, how well do I listen? How well do I hear? Because listening and validating, like you were saying earlier, is such an empowerment practice in itself. And if we had that kind of culture where there was equity in our ears, in the way that we use our ears.
And I think with that is the idea of, and kind of what you said with meetings of, I want everyone to share something. Also, I hope everyone leaves with something. And so if we shift the focus of not just what am I here to contribute, but also what can I gain from this experience, because we can all learn from each other. I believe there's always something to learn. I'm constantly learning. Every day I learn and I love to learn, thank goodness. And recognizing though, that it's a lifelong journey. And so these meetings too is, what can I learn from this meeting? Not only what do I have to bring to the table, but what can I take away from this interaction? And how can I then, because if my goal going into a meeting is my goal is to learn something, I'm more likely to be more curious and ask questions because I want to learn something, as opposed to, oh, I have to show up and tell people something. Okay, I better make sure that I get a chance to say what I need to say. So now my focus, kind of like when we talk about true listening, right? So the difference in listening to someone and be like, yeah, okay, versus actually engaging and listening to the words they say with the intent to actually hear them and understand them, and not the intent to reply, which is such a hard thing to do.
Yeah.
And it's really a true gift that we give very few people, because our brains truly can't do that to everyone all day. That doesn't work that way. And so we have to choose those people that we intentionally, mindfully listen to actually understand them, versus just to reply to them. And so if we show up at meetings, I think, with the intent of, I really want to understand, and that's that curiosity of perspective. How can I better understand the dynamic here and how I can collaborate? I'm not trying to compete. I'm not trying to be the loudest voice. I'm not trying to have the best idea. Often I don't have the best ideas, but gosh, I could learn so much and collaborate with my way of thinking with someone else's, and that could be a really different experience.
Absolutely, absolutely. And you brought up a key word there, collaboration. Collaboration is really only possible if you are listening. Yeah, wow, wow. Um, well, let's turn our attention to some questions. There's one in the chat so far, and I'm actually just going to expand on this question a little bit. And I apologize to the person who submitted the question. It's not my intent to, but I see an opportunity to ask Dr. Ruffin another thing within this question. Um, do you only see patients within our OB department or in our women's health center?
Yes.
Okay.
So well, yes and no. I see all women. I see anyone at their OB or GYN appointments, that are scheduled here at University Health too.
Okay.
So I'm able to go to those appointments at the time of their appointments
Mhm.
usually. And then I'm able to schedule a very small percentage of people for follow-up. And right now it's, mostly employees that I'm able to see.
Okay. My expansion on that question is, what other video, book, local resources would you recommend us access for our own emotional health?
Well, I feel like there's a plug. And just to be very clear, I get no kickback for this. I think I should, but the Ownership Yard is one that I love. And then kind of depending on what your focus is, or what like you're looking to learn more about yourself, would kind of dictate my answer. But there are a lot of great resources, not so many that I'm aware of locally, especially post-COVID, with everything being virtual. It doesn't mean it's not maybe as familiar. Um, but there's a lot of great online resources. It just kind of depends. Trying to think of something I tell people to go, to just Google like core values, start there, create a list, and go down and go from like your top 10 to your top 5 to top 3 to top 1, and then create like vision boards and think about, what do I want in my life? What are my values? What are choices that I'm making? And again, looking at decisions in our lives, taking away the idea that it's right or wrong or good or bad, and
Mhm.
instead saying, how does this align with my value or my goal? Because then we take this pressure off of like, it has to be just right. And instead it's, okay, I'm choosing to do this because it aligns with my goal of whatever that goal may be. And it also changes up here from I have to, I like must, all those thoughts that feel, very, um, I don't know the right word here, the opposite of being empowered, whenever we feel like we have to do something, versus I'm choosing to. So even I use the example of, um, don't really like writing notes. Not my favorite thing, not my strength. And so there's a shift, and I have to write my note. Actually, no, I don't. I could choose not to. I might not have a job or a license, so I wouldn't be able to do the things I love. So because those things are important to me, I'm choosing to write my notes because I value having a license to practice and having a job and being able to do those things. And that's why I'm choosing to do it. And so shifting the language there, and that comes from I really just have people go to Google, for a values-based exercise. And then I'm trying to think, I could probably email you some other recommendations after I think about it.
Okay. If you're interested in any other recommendations that Dr. Ruffin shares with me, if you email equity, diversity, and inclusion at tmcmed.org. I can certainly forward anything she might share with me. Yeah, because I'm curious of the same.
And I would also welcome anybody if they have like a specific kind of interest that they're looking in, like where would I find a good resource for values or for knowing myself or anything at all, like it's a specific, if they're comfortable letting you know, or they could email me directly. I'm always more than happy to share information. It's just something I really, really like to do.
Our time is starting to wind down here. I would like to take just a moment to thank a couple of people. Crystal Captain and the women, yeah, everybody smiles when they hear the name Crystal Captain. Aaron Real Muto in public relations and marketing. Lori Scott Austin also in public relations and marketing. I mentioned them in our previous Women in Leadership session because they were integral into the planning of Truman's Women's History Month celebrations, and I could not, of course, as a man, I could not have led that. But even on top of that, like they had so many great ideas, they led so many things so quickly and got it done so fast, and it's just like I just want to thank them for their partnership really quick. So thank you, Lori, Aaron, and Crystal. Thank you, Dr. Johnson, again, for participating in our previous session. In our chat, I put the link for our previous session. It is at Truman Medical Center's website at the Diversity and Inclusion page. You can find it there. It is also on YouTube. Again, the link is within our chat. The link for the article with Hayat Abdullahi is also in our chat, so you can access it there. In closing, I think I just want to wrap with saying, Dr. Ruffin, I've only had a handful of conversations with you, but you are an absolute champion of yourself. And what I mean by that is you've shown me exactly how far you can get just by simply having this deep practice of self-acceptance, self-love, and cultivating who you are. So I want to give you that compliment. I hope you receive the compliment well.
Thank you. I appreciate
I
that.
feel like yeah, of course. I feel like it's actually a minimization of what I want to express, but I think that's the best way to say what's on my mind for you is you've shown me that being a champion of yourself gets you so far and also teaches so many people so many great things. I want to thank you for showing me constructive ways that I could be an advocate and an ally toward women and in our workplace, in our shared workplace, but also just in our culture. As a husband and father, I really value everything that you've said today. So thank you very much for your time today again.
You are welcome, and thank you for your time in this platform to share information. And double shout out to Crystal Captain. Truly, I think one other piece that I didn't really hit on, and you kind of clicked whenever you were talking about that powerhouse of women you had in the meeting to get this going, is recognizing that power, I think, and that goes to collaboration versus competition too. But the power of connecting with other people you work with, also recognizing mentorship, especially for women in healthcare or in any kind of leadership, is finding those mentors, finding those people who you can get support from and can connect with, because Crystal is my director here, and she's phenomenal and has been a really big part of what I think helps keep me going on those days when the system can be hard. And having people, though, who are in your corner, who are supportive, can make the biggest difference in the world. So all of those power people who are there and supporting their teams are amazing and make an incredible difference.
Yeah. Well, thank you again for attending, everybody. Thank you for the compliments that you're giving Dr. Ruffin and everything she shared today. Of course, you did a fantastic job, and you're an amazing person, and having this conversation today was completely an honor. So thanks again.
Thank you.
Yeah, everyone, I hope you've enjoyed our final Women in Leadership session for Women's History Month. This will be published on Truman Medical Center's website at the Diversity and Inclusion page. Yeah, it's kind of just hitting me that it's closing. I've learned a lot from you. I've learned a lot from Hayat Abdullahi, and I've learned a lot from Dr. Tracy Johnson. And I invite everybody to revisit these conversations and challenge yourselves with the thoughts, empower yourself with these thoughts, because these women have shared so many great ways to be able to be an advocate and an ally for women, as well as just show you exactly how far our culture could go when we're all champions of each other and in pursuit of equity. So yeah, thank you again, everybody. I hope everybody enjoys your day.